Maybe you just need to call in with member Elsasser. All right, welcome, Brian. All right, we're going to jump right into informational items. And first, we have the Board of Health. Welcome, Monica. Is that on there? Oh, let's see. Never mind. Yeah, we'll go with it. We're going to go with the flow.
Do you need to go ahead with the minutes? I can.
No, we're good. I'll come back.
Okay. In your packet, I'm also going to be covering the EMA as well. In your packet is the Board of Health minutes from August. A couple of things to highlight from them. This has been just an update. The board officially approved our community health needs assessment document. This is the same document we share with our neighboring counties as well as OSF St. Francis Medical Center and Carl West Peoria. Additionally, part of our Board of Health strategic plan was workforce development, looking at our mid-management and our management structure, training, and compensation. And so we were able to do a wage compression adjustment for our staff as well as part of the August agenda. I was asked prior to start to kind of talk a little bit about vaccinations in light of ACIP's meeting on the 18th and 19th, as well as the Illinois Advisory Panel for Immunizations. So I'm going to start with kind of dissecting the ACIP regulations. And just as a reminder and kind of level set, the Centers for Disease Control and Prevention, or CDC, does have an advisory panel related to vaccinations. They make recommendations which also direct insurance, which is really key, as well as our federal allocation of vaccines, especially for children, known as Vaccines for Children, or VFC. The meeting on the 18th and 19th really focused on 3 different vaccinations. The first one was related to MMRV, which is mumps, measles, rubella, varicella. It's a combined vaccine. So for parents out there, I can attest, you want to give your child maybe 1 shot versus 2. It's a combined vaccination. They made the decision on Thursday to separate out MMR and varicella separately to really get 2 vaccines rather than have them combined. They also made the decision on Thursday to still include it as part of the VFC program, or Vaccine for Children program. And this is very important for us because any child that's on Medicaid is eligible for VFC. Any child that is underinsured or uninsured is also eligible for VFC. So as of Thursday, MMRV was available from the VFC program. On Friday, they made the decisions related to reversing access of MMRV in the VFC program. And while a child can still receive MMR and a varicella vaccine, so 2 vaccine or 2 shots, so to speak, it can be very confusing if you're reading the headlines to understand what this change really means. It also can be very confusing to parents as they are understanding their vaccination schedule. The second vaccine that was discussed at ACIP was hepatitis B, and this is really primarily done right after birth with concerns of hepatitis B transmitting from mother to child. Most of the regulations was focused on just excluding it and focusing on screenings for mothers, which makes sense. However, to give you just a data point for Peoria County alone, only 2/3 of our pregnant women get prenatal care within the first trimester, which means we actually don't receive adequate prenatal care. So again, the onus of where do you put that intervention point, whether it's at birth for the child or trying to get screenings, really the birth is where we're going to capture the largest population base. However, they reversed it completely and they've tabled that decision. So we're still waiting for what the final results are for hepatitis B. The last one, of course, is the 2025-2026 COVID vaccine. And this one, we are not surprised by, came back as personal discretion. So, which again creates a lot of concerns when you realize that ASIP helps with directing insurance. So if it's a personal discretion, I'm thinking about our own insurance plan, will that be covered? And so it leaves a lot of unknowns. However, Illinois has actually taken the steps through an executive order to talk about the ability to access vaccines. So I want to make it very clear, the executive order and what IDPH is proposing does not create any new mandates for vaccine. The Illinois School Board of Education requirements are still there. Other requirements are there. What they're trying to do with the executive order is fill the access question. So looking at the two vaccines that really came out from ASIP, there's COVID-19 and then there's the MMRV. So for the MMRV, it is looking at how do they supplement VFC, knowing that we will not be able to necessarily get the federal allocation for that vaccine. Again, we'll make it very clear, you can still get MMR and you can still get varicella, but the combined vaccine is what is in question. And then the other one is related to COVID-19. While it is personal choice, there is a lot of discretion in terms of your age range, so still recommended and approved from the FDA side of it for individuals 65 and older, as well as a large group of people that are considered high risk, whether it's overweight, obese, low physical activity, respiratory issues, chronic health conditions. And it's self-reported. The challenge, though, is how do you make the access available if, one, you don't have a primary care provider, or you might have never seen a primary care provider. We have a large population that does not seek medical care until they're further along in their age. And so part of this is to allow for standing orders, which is when a medical director provides the governance in which you are able to give vaccinations or prescribe medication, and to expand that. So Peoria City County Health Department, our medical director is Dr. Greg Stoner. So we'll be working with him to look at our own standing orders, but for the full state, especially those healthcare providers that have the ability to administer vaccines, such as pharmacists, there'll be a need to have standing orders that's statewide. And so IDPH would be recognizing that and providing those standing orders. They've done that in the past already for things such as Narcan. So Narcan is available through a standing order from the state medical director. So they're kind of moving that same direction. So as you can see, I think someone asked me this a while back, I think actually my own board member, Betty Duncan, it's whiplash right now for public health. We'll hear one thing, tomorrow we'll hear something different. We'll be funded one day, we'll not be funded the next day. It's ongoing. What makes the VFC program, and it does impact us locally very, especially as we go into budget discussion, is we might have to supplement the VFC portion of our inventory with private pay. So that would mean that the health department would look at their drug and medication budget as well as even their reserve to actually be able to create that supplement to make sure we still have access for vaccines, especially for those uninsured, underinsured, and children on Medicaid. As a reminder, everyone get your flu shot too. That's all I have. Any questions?
Yes, Dr. Blair.
Just a comment. I want to thank Monica and all of her staff for working so hard to educate the community and trying to keep us all healthy.
Appreciate that. And I think that's going to be the biggest challenge is there's a lot of information. Just as a kind of side commentary, I took my mom to her annual appointment today, and even she was like, "Can I get my COVID vaccine?" I was like, "Yes, go ahead and get your COVID vaccine. You're over 65, Mom." But it's very confusing because often we don't know what kind of information and where we should be getting our information from.
Thank you for all that information. Appreciate it. Any other questions? Okay, thank you.
And I will then give Jason Marks his report as EMA. He has his monthly September report. September was for, especially for the preparedness program, National Preparedness Month. And so not only was there the different meeting cadences that he's had, but as well as he's done an exercise with the Illinois Department of Corrections, Adult Transition Center, and then a lot of outreach, which included meeting with some of our elected officials. More than happy to answer any questions. And I just want to note that Jason's not here because he's actually at a pipeline training. So again, always making sure that we are prepared as a community.
He's a very busy guy. Yes. Thank you. Any questions for EMA? All right. Thank you very much. All right. Next, we have the Regional Office of Education. You're solo today.
I know. Which means I'll be very quick.
That's fine.
So no George today. He's at a training, but he just asked if I would come and answer any questions on the data that I send you. We did triple, our number of home visits from August to September. So with school starting up, we have tripled our number of home visits and more than doubled our number of phone calls, texts, and emails. So I'm very happy with that. I am excited to announce that we have 10 of our Tier 2 kids. So those are kids that were not successful in Tier 1. We moved them to Tier 2. They experienced Truancy Advisory Board, where we met with the parents, did some more extensive resources, and we have 10 of those kids exiting. Some of them we had one kid go from 47% attendance at the end of last year to 100% attendance at the beginning of this year. So that's from July 30th until last Friday. So September 19th, they've been to school every day. We had one student go from 66% to 100%, and then another student go from 57% to 96%. So Angelo Parker, our Tier 2 specialist, deserves all the credit for that, but he's doing a great job working with our families and getting them to school. I don't know if anybody has any questions.
Any questions? And what I understand, we did get the truancy grant, correct?
We did, and then somebody did an appeal, and so we're waiting to hear how much we're going to get. But we did get it, so we're super excited about
Awesome. Great. Thank you. Any
Thank
questions?
you, guys.
All right. Thank you.
Have a great afternoon.
You too. All right. And last for informational is sustainability resource. Hello, Becca.
Hi, good afternoon. I do just have some additions to the brief that was submitted. Electronics collection, always a little bit of a moving target, but great relationship with the townships. So I have two collections listed, but it has moved to 4, all in October and maybe the first weekend of November. That one is still shaping up a little bit, but the October 4th is Limestone Township residents. 10/18 will be Peoria Township, so that'll be a larger one. Timber and Rosefield are on board to participate as well. Timber will be the 25th of October. So all of those will be direct mailings aside from the Peoria Township one to the residents of those townships. I also wanted to highlight a little bit about the hazardous waste collections and how those are going. As a reminder, we have 3 collections that were scheduled this fall. We're 2/3 of the way through those. And those are conducted by GFL as part of the landfill agreement that they would accept 150,000 pounds of HHW, better known as household hazardous waste, sorry. And we are 98,195 pounds in after those 2 collections. And in looking at the list of materials accepted, you will see that latex paint is accepted. And that was 62% of what was collected at the last September 13th collection. This will not be included next year. Producer responsibility does roll into place at the beginning of next year, or extended producer responsibility for paint, including latex paint, does come into play in 2026. We will be taking full advantage of that and not including it in the hazardous waste collections because latex paint is not truly hazardous. It's just kind of a pain. So residents have definitely been utilizing that service. Another thing that I wanted to highlight, I mentioned last time we met that we received over 1,000 tires at our unit of local government tire collection through the IEPA that I apply for each year. They are introducing a new pilot program for residential collection of tires, and our neighbor, Tazewell County, is piloting that. It's over 5 days with multiple locations for residential drop-off of tires. So we will see how that goes with them. That was advertised in the newsletter. We plan to do some more advertising around that as well, a little closer to the date. It's mid-October, the 14th through the 18th, because that is open to anyone in the state of Illinois. So we'll be sure to promote that. And let me know if you have any more questions regarding that. Township Supervisors Group does meet on the 8th, and it's going to be a packed meeting with Veterans Assistance Commission, talking a little bit about general aid and what that looks like in terms of townships, also doing the same general assistance. Planning and Zoning will be there to talk about land use plan. And then the Landfill Committee has not met in a while, have not had a quorum, but are scheduled, unless they add an additional one, October 29th should be the next event. We did discuss at the last meeting, I just want to follow up, GFL does still plan on doing a push out publicity on their subscription program. At the end of August, we meet again on Friday, we meet monthly. They had 1,079 subscriptions in the program. And also Eagle Enterprises and Waste Management have comparable rates that they've pushed out for full service collection to those areas. So I'll meet with GFL on Friday and discuss exactly where they're planning on targeting, if they're going to do the entire area that is could potentially be covered by the subscription program, or if they're targeting areas of low participation. And then I'll come in behind and kind of try and fill that gap to make sure that everybody knows of that program, as well as just good old social media posts and reminders in that regard. The Regional Food Council does meet next Friday, the 3rd, at HHS, and the topic is waste recovery. So that's me. Pretty excited about that. And then also Hunger Action Month is this month. We have more information to share. Monica and I will do sort of a joint presentation. She'll talk next month about, she'll talk about the community health improvement plan process. And then I also will share some data from this month and what was done. But food insecurity, as you know, is a big issue across the Tri-County area. In Peoria County, 14.5% or 26,100 individuals are food insecure. 1 in 7 children in the Tri-County area face hunger. So a lot of work is done with the Partnership for Healthy Communities and Healthy Eating, Active Living partnership through funding through the Community Foundation to do that work. And that's something that I participate in on the periphery as part of Regional Food Council. And Monica's staff participates, as you might imagine, in a greater capacity. So we're happy to share more information about that next month as well. And I will answer any questions that you might have.
All right, thank you. Any questions? None? Do we have status on the second position?
I had the first interview today, and Brittany Graves is sitting in as the person to interview, and we have another one scheduled for Thursday. Total of 10 applicants, so some great qualified applicants too, so very excited.
Great, thank you. Okay, shut myself off. All right, we're going to jump back up to the approval of the minutes. So can I get a motion to approve the minutes from the July 29th meeting, please? Member Phelan and second by Member Duncan. Any additions or corrections? Okay, we can vote to approve or not approve.
I vote aye, Mr. Chairman. Mr. Chairman, I vote aye.
Thank you, Brian. Brian was an aye. Fantastic, thank you. And finally, I just need a motion for us to review the executive session minutes. Can I get a motion? Thank you, Member Coates, and a second by Member Bryant. Okay, Jenny.
It remains a recommendation of the state's attorney's office that all previously held minutes continue to be held because the need for confidentiality still exists, and to destroy the executive session audio recordings that are more than 2 years old, except for those that relate to pending litigation.
Okay, any questions? All right, please vote.
I vote aye, Mr. Chairman.
Thank you, Member Elsasser. He was an aye. All right, thank you. Next, we have no discussions. Public comment? Anything for miscellaneous? Okay, we're adjourned. Thank you.